Have you ever wondered where this gelatin comes from? It's actually derived from the collagen found in animal bones, following a meticulous purification process right here in the facility.
The journey of transforming animal bones into medical-grade gelatin begins at a stage that many viewers might underestimate. Yet professionals know it determines the success or failure of everything that follows. Sourcing and selection of raw materials. In the context of medical use, gelatin is not a simple byproduct or commodity. It is a biomaterial that will eventually enter the human body, sometimes directly into the bloodstream, sometimes as part of life-saving medication. For that reason, the origin of the bones is governed by strict international regulations and ethical standards. Most medical gelatin is derived from bovine or porcine bones, obtained exclusively from certified slaughterhouses, where animals have passed rigorous veterinary inspections. Each batch of bones must be fully traceable, with records detailing species, age, health condition, and geographic origin. This traceability is not bureaucratic excess. It is a safeguard against biological risks such as prion diseases, bacterial contamination, or chemical residues. The bones are collected shortly after slaughter to minimize degradation and are transported under temperature-controlled conditions to prevent microbial growth. Even at this early stage, time becomes a critical variable. Delay can mean spoilage, and spoilage means rejection. Upon arrival at the processing facility, the bones undergo a detailed visual and mechanical inspection. Any foreign materials such as metal fragments, dirt, or excessive soft tissue are removed. This step is surprisingly meticulous. Sensors, magnets, and manual checks work together to ensure that nothing unintended enters the production line. The bones are then sorted by size and type, because uniformity later affects chemical treatment efficiency. To an outside observer, these steps may appear repetitive or overly cautious, but in medical manufacturing, consistency is safety. A single contaminated batch can compromise thousands of doses of medicine. As the bones move forward, one might ask, why begin with bones at all, when synthetic alternatives exist? The answer lies hidden within the bone structure collagen fibers that have evolved to be strong, flexible, and biologically compatible. But how can this natural strength be preserved while stripping away everything else? The next phase introduces controlled force, crushing, and size reduction. Whole bones are too dense and impermeable for efficient processing, so they are mechanically broken into smaller fragments. This increases surface area and allows later treatments to penetrate evenly. Industrial crushers reduce the bones into chips of standardized dimensions, carefully monitored to avoid excessive heat generation, which could denature proteins prematurely. The sound and power of this step contrasts sharply with its purpose, not destruction, but preparation. The goal is to expose the internal matrix without damaging the collagen network embedded within. Once crushed, the bone fragments are immediately transferred to washing systems to prevent oxidation and contamination. Here, large volumes of hot water are used to flush away blood residues and soluble impurities. In some cases, mild alkaline solutions assist in loosening stubborn organic matter. The water is continuously filtered and replaced, maintaining hygiene and preventing cross-contamination between batches. Degreasing follows, addressing one of the most problematic components of bone: fat. Lipids interfere with gelatin purity and stability, making their removal essential for medical applications. Heat, mechanical agitation, and sometimes food-grade solvents work together to extract fats from the porous bone matrix. Sensors monitor fat concentration in the wash water, signaling when acceptable thresholds are reached. This is a delicate operation. Too little degreasing leaves residues that compromise quality, while too much can weaken the collagen structure. Throughout this phase, samples are sent to in-house laboratories for analysis of microbial load, protein integrity, and lipid content. Each result determines whether the batch proceeds or is discarded. It raises an intriguing question for the viewer. At what point does raw biological material cease to be animal and begin to become a medical resource? By the end of this initial stage, the bones have lost much of their original identity. They are cleaner, lighter in color, and more porous, stripped of visible fats and contaminants. Yet they are still bones, rigid, mineralized, and far from gelatin. What remains unseen is the collagen, tightly locked within a mineral framework of calcium phosphate. The process so far has only prepared the gate. It has not yet opened it. As these prepared bone fragments are moved toward the next phase, anticipation builds. If collagen is the true treasure hidden inside bone, what method will be gentle enough to release it without breaking it apart? And once freed, can it truly be transformed into a substance trusted by modern medicine? Or does the greatest challenge still lie ahead? After the bones have been thoroughly cleaned, crushed, and stripped of fats and surface impurities, the process enters a phase that marks the true turning point in their transformation: demineralization. Up to this moment, everything has been preparation, removing what does not belong, reducing size, ensuring purity. Now, the focus shifts to what lies at the heart of the bone itself. Although bones appear solid and lifeless, their strength comes from a complex marriage between minerals and organic matter. Calcium phosphate crystals give bone its rigidity, while collagen fibers provide flexibility and resilience. To obtain gelatin, this mineral armor must be removed, but the collagen framework must remain intact. The challenge is immense. How do you dissolve stone without breaking silk woven inside it? Demineralization begins by immersing the prepared bone fragments into carefully controlled acidic solutions, most commonly dilute hydrochloric acid. The choice of acid is deliberate. It must be strong enough to react with calcium salts, yet mild enough to avoid aggressive hydrolysis of collagen chains. As the bones soak, a slow chemical reaction unfolds. Calcium phosphate gradually dissolves, forming soluble salts that diffuse into the surrounding liquid. Bubbles may appear, subtle signs of minerals surrendering their grip. This process is not rushed. Depending on bone size, density, and species, demineralization can take several days or even weeks. Time here is not a cost, but a safeguard. Speed would mean structural damage, and damage at this stage is irreversible. Throughout demineralization, every parameter is monitored with precision. Acid concentration, temperature, and pH are continuously measured and adjusted. If the solution becomes too acidic, collagen chains may begin to break prematurely, reducing gelatin yield and strength. If it is too weak, mineral removal becomes incomplete, leaving residues that will later interfere with extraction. Operators regularly sample the material, testing mineral content and physical texture. Gradually, a remarkable change occurs. The rigid bone fragments lose their hardness and become flexible, almost rubber-like. This new material is known as ossine, a collagen-rich matrix stripped of most of its mineral content. At this moment, the original identity of bone disappears entirely. What once supported muscle and protected organs is now soft, pliable, and translucent. The viewer might pause and wonder, when bone can be bent by hand, has it already stopped being bone at all? Once demineralization reaches its target level, the process moves into extensive washing and neutralization. The ossine is repeatedly rinsed with large volumes of purified water to remove residual acid and dissolved salts. This step is just as critical as the acid treatment itself. Any remaining acid could continue reacting, damaging collagen, or creating safety risks in later stages. Washing continues until the pH of the material approaches neutrality, a sign that chemical reactions have been brought under control. This stage consumes vast amounts of water and energy, reflecting a core truth of medical manufacturing. Purity is expensive, but contamination is far more costly. Samples are again analyzed in laboratories to confirm mineral removal, microbial safety, and collagen integrity. Only when strict criteria are met can the batch proceed. At this point, the material undergoes conditioning, a quiet but decisive phase that prepares collagen for its final transformation. Depending on the desired properties of the final gelatin, the ossine may be treated with mild alkaline solutions or enzymes to adjust the structure of collagen fibers. These treatments subtly influence how collagen will later break down into gelatin, affecting viscosity, gel strength, and thermal behavior. This is where science meets foresight. The manufacturer is no longer simply removing unwanted components, but actively shaping the functional characteristics of a future medical product. Every decision echoes forward into capsules, injectable formulations, and biomedical devices not yet visible. By the end of this second stage, the process has crossed an invisible threshold. The minerals that once defined bone are gone, and collagen stands exposed and vulnerable. It has been preserved, purified, and prepared, but it is still collagen, not yet gelatin. The material now holds immense potential, but also immense fragility. One misstep in the next phase could unravel weeks of careful work. As the Awakens waits for extraction, a compelling question lingers for the viewer. Once collagen has been freed from its mineral prison, what force will transform it into gelatin without destroying its delicate balance? And will that transformation be as controlled as everything that came before? With collagen now liberated from its mineral framework and stabilized through careful conditioning, the process enters its most decisive and delicate phase: extraction. This is the moment when collagen, still structured and insoluble, is intentionally transformed into gelatin, a substance defined not by rigidity, but by its ability to dissolve, flow, and reform into a gel with remarkable reliability. The challenge is no longer about removal, but transformation. Collagen must be broken down, yet not destroyed, unfolded, yet not fragmented beyond usefulness. The entire success of medical-grade gelatin depends on how precisely this balance is achieved. Extraction begins by transferring the conditioned Awakens into large stainless steel extraction vessels filled with highly purified water. These vessels are designed to maintain absolute control over temperature, pressure, and time. The process unfolds in stages, each carefully calibrated. Initially, the temperature is raised slowly, often starting just above body temperature. At this level, the triple helix structure of collagen begins to loosen. Hydrogen bonds that once held the structure together weaken, allowing long protein chains to partially unwind and migrate into the surrounding water. This first extraction yields gelatin with high molecular weight and excellent gel strength, properties essential for medical capsules and pharmaceutical coatings. Nothing is rushed. The heating rate is gradual, and constant monitoring ensures that the collagen is encouraged to open, not forced to break. Once the first extraction cycle is complete, the gelatin-rich liquid is gently drained from the vessel, leaving the remaining Awakens behind for subsequent extractions. Each new cycle increases the temperature slightly, unlocking additional collagen fractions that require more energy to dissolve. These later extracts may have lower gel strength but possess other valuable characteristics, such as clarity or specific viscosity profiles, making them suitable for stabilizers, plasma expanders, or absorbable medical materials. This staged approach reflects a deep understanding of collagen behavior. Not all gelatin is the same, and medical applications demand precise functional diversity. At this point, one might ask, how can a single raw material give rise to so many different medical solutions simply by adjusting heat and time? As gelatin dissolves into the extraction water, it carries with it not only protein chains but also traces of impurities. To address this, the liquid extract undergoes filtration while still hot. Fine filters and sometimes centrifugation remove insoluble particles, ensuring clarity and uniformity. In some processes, activated carbon is introduced to absorb color compounds and organic residues. The liquid gradually becomes a clear, amber-toned solution, visually far removed from its origin as bone. Yet visual clarity is not enough. Samples are constantly tested for microbial content, protein distribution, and endotoxin levels. In medical manufacturing, invisibility does not mean absence, and every unseen variable must be accounted for. Following filtration, the gelatin solution is concentrated by evaporation under reduced pressure. This step removes excess water while avoiding high temperatures that could degrade the protein. As concentration increases, viscosity rises, and the liquid begins to behave more like the gelatin we recognize. Still, it remains a liquid, held in a narrow window between stability and degradation. Operators monitor concentration levels with extreme care, knowing that overconcentration can lead to premature gelling or molecular damage. It is here that experience often matters as much as instrumentation. Data guides decisions, but intuition built from years of observing gelatin behavior plays a silent role. By the end of the extraction phase, gelatin has been born, but it is not yet finished. It exists as a controlled, purified solution, carrying within it the functional properties that will later define its medical use. The transformation is profound. Collagen, once a structural protein locked inside bone, has become a dynamic substance capable of encapsulating drugs, stabilizing vaccines, or supporting healing tissues. Yet this gelatin is still vulnerable. Its final quality depends on how it is refined, dried, and standardized in the next stages. As the warm solution flows toward purification and drying systems, a final question emerges for the viewer. Now that gelatin exists, how can it be preserved, standardized, and made absolutely safe for the human body without losing the very properties that make it so valuable? After extraction,